You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and Happy New Year. It's 2022. So today I want to talk to you about a topic I've been thinking about talking about for a while, and I'm honest with you, I don't know a ton about it, but I've learned a lot more about this in the past month, and I'm learning more and more every day, and that's talking about CBD products. So, you know, it's funny that medicine changes so quickly, and in medical school, there's a lot of stuff that we just weren't really taught about. And then all of a sudden, things change, and it's a lifelong learning process, I think, for anything, but especially in medicine. So you have to be willing and open to look at things. Now, the reason I've been really interested in this, it really comes back down to a lot of things that I do in medicine, specifically knee replacement, which can be very painful and have a lot of other side effects. Commonly patients have a lot of difficulty with sleep. So patients have always come in the office in the past for many years, with the most common supplements, back then were glucosamine and chondroitin, and then people asked about turmeric and curcumin and other types of supplements they may use. And more recently, it has been the idea of CBD. Now, pain is something that we deal with, and I admit that in the beginning of my practice, I was bad at it because I did what I was taught, and I did what everybody else did, and it was, you had a knee replacement, here's 150 Percocet. Good luck, take them as needed. There wasn't really any guidance, and we just assumed that, we were told, hey, they're safe, right? That's what the pharmaceutical companies all told us. They're safe, they're not addictive, they're fine. And on top of that, and I'm sure, and it's a whole different discussion, but you get these companies and lobbyists that go after the government. Hey, they're safe. You should make the doctors do this. And they set these pain as the fifth vital sign. And, at risk of, finding you or coming after you if patients had pain. But the reality is that, especially when you have pain or when you have surgery, there's going to be pain. Like, it's not going to be pain-free. Unfortunately, opioids alone were not the solution. And I personally saw patients suffer from the side effects of these opioids. And that was my personal stimulus for changing what I was taught and what I was doing. I saw patients get addicted, and I am partially responsible for that. But I also saw untoward side effects, constipation being very common. And I know of 3 patients, many more that were in a hospital because of constipation that required treatment, but 3 that had constipation that led to a perforation of the bowel, which required some type of emergency surgery, and very frequently requiring a colostomy. So that's the bag where your intestines are hooked up to, because there's an issue with the colon, and at the first surgery, they couldn't, reattach it from end to end. So those are big deals when you're talking about coming in to have a surgery for arthritis. And these are side effects of the drug that we use to control pain, not directly a result of the surgery. So that's where I started changing things. And when we started using anti-inflammatories and Tylenol, the concern always was bleeding with anti-inflammatories, and Tylenol of, liver disease and liver failure. And the idea of polypharmacy, meaning multiple medications, and you're going to confuse patients. But the reality was that we had to do a better job of educating patients, and we had to do a better job of explaining how to control pain. And I talk to patients that, pain is not just one thing. It's not just one receptor. It's not just one feeling. So you can't just use one drug. So the idea of multimodal polypharmacy is to use different drugs that combat different receptors. So you can use each of those drugs in the lowest dose possible, so you have the lowest risk of side effects, to control pain, because pain is multifactorial. So very commonly we talk about using Tylenol or acetaminophen along with some type of anti-inflammatory. Sometimes we'll use a nerve pill. And then on top of that, for severe breakthrough pain, we may add in a low-dose opioid or narcotic. But is there something else? And that's where I've become more interested in CBD, because a lot of patients would come in and say, for arthritis pain, well, what about CBD? And if I have surgery, can I use my CBD? Do I have to stop my CBD? Can I keep taking my CBD? And the honest answer was, I don't know. I was never taught that. Because CBD was a drug and it was made from the marijuana plant and also can be made from hemp. So we'll get into that. And because it's not legal by the federal government, but it was legalized in some states, that's where it became this really weird sort of fine line that I think many of us walked through. Was we had, licenses that were governed by the state and the country, and how do you recommend something? And there weren't very good studies done. And this is the reality that I had with many patients, is they would say, well, my friend told me, or my daughter or a son told me, or, my spouse was using and I borrowed it. And is it safe? And what brand should I buy? And what should I take? And what's the dose? And the honest truth I told patients was, I don't know. Because if you go to the dispensary or you go online and you buy product A or product B from company A or B, I have no idea what they put in it. I have no idea what the percentages are and the combinations are. And I have no idea what the side effects are and, what other bad things may be in it, like mold and fungus. Are there other contaminants? And here comes the big thing, where in 2018, when the Farm Bill Act came into place, where you could grow hemp. So you could grow hemp to make CBD, but you still couldn't use marijuana, the marijuana plant, to extract the CBD, because that had THC in it. This is federally, certain states allow it. But this is the problem that, people always say, hey, if your patient comes in and they're using CBD, are they getting high? And that's the big question. So these are all the things. So there was a Gallup poll that was done in 2019. It was pretty interesting. And it found that 1 in 5 Americans currently are using CBD. And what I found is, as I started asking patients, are you using Tylenol? Are you using anti-inflammatories? Have you had cortisone injections? Do you use CBD? And a large majority of patients are using CBD. They may be using a cream, they may be using a pill, they may be using drops, but many patients are. And again, I work in California, so maybe it's different in different states, but a large majority of patients that I saw, and even more than 1 in 5 in patients that I see, are using CBD products. And if you don't ask, many of them were afraid to bring it up. Like, well, I wasn't going to tell you because I wasn't sure how you felt about it. So I think as doctors, it's our responsibility to really ask the question and be open with patients and say, hey, are you using it? It's okay. Let me know. I want to know. But when they would ask me what to use, I would always tell them, I don't know. I can't tell you. So there was another study that was done, and it found about 20, if I remember, it's 22 or 24% of products that were tested, these are CBD products, had THC of some amount in them. So you're using a product that you think might be safe. But unfortunately, that a bunch of that, almost a quarter, had THC in it. Now that's the chemical that's going to get you high. And you may not be looking for that in the product that you want. So it is interesting to know that, there's different receptors in the body. So these CBD and THC are different. And when you get CBD, you're getting it from the hemp plant. When you have marijuana, you can get CBD and THC. THC affects one type of receptor, and the CBD can affect others. And this is where it's going to be interesting. And I suspect in the next 5 to 10 years, you're going to see a lot of these pharmaceutical companies, they're going to start to extract this stuff, and they're going to start to formulate these to combat very specific diseases. But right now, when you're looking at all the receptors, CB1 receptors, these control inflammation, they control blood pressure, mood, memory. CBD receptors control inflammation, the immune system, bone, skin, cardiovascular, kidney, liver system. So they involve a lot of stuff in our body. We have these receptors that can react to THC and CBD, but THC only affects the CB1. So that's inflammation, blood pressure, mood, memory, where CBD can affect all of those, both CB1 and CB2. Now, as far as going forward with the idea of, what brands should you use, this is where I started getting very interested, because there's a company that I spoke with, and I'm very enthusiastic about their product. This is a company called Corganics. And what's nice is the two guys that started this company came from the pharmaceutical world. And they have a pharmaceutical background. They have a pharmaceutical mentality. So the idea for them was to find places that grow hemp in good quality and find places that then process hemp in a quality control measure. Because what I started learning and finding out was a lot of these places would grow hemp like, hey, I can make money, but they didn't know how to process it. It would sit there, it would get moldy, and it would be moist, and it would develop fungus. And then there's different ways of extracting the CBD, and a lot of those can contain chemicals. So you have all of these processes in the chain of growing it to where it sits, how it's stored, how the CBD is extracted, and then how it's made into some formulation, a cream, a pill, a drop, and then you're ingesting this stuff. So that was the scary thing. So they have worked with farmers. They have a very specific pathway to get it produced. What's also very interesting is they do third-party testing. So this was another study that was done, a Leaf report, and they looked at 136 brands. It was almost 3,000 different products, CBD products, and they found a quarter of them had no purity testing whatsoever. And 84% of the tested products had mislabeling of the potency of what was in them. So that's a big deal, because you're buying things, and again, it's these big things not regulated by the FDA, but you're hoping and assuming that the companies that make these are fairly cautious with what they're selling you, and a lot of these studies are showing that a lot of those products aren't. So there's another study that was going on now called the ACEs trial, which I'm really interested to see what the results of that are going to be. It's coming out, I believe, in March. They've released some early preliminary data, and this is called the Advancing Cannabinoid Education and Science, the ACEs trial. And they looked at what we would consider scientific sort of study stuff, where they're looking at outcomes, looking at well-being scores, quality of life measures, sleep quality, anxiety scores, pain scores, and they're using well-validated scoring tests to look at this. And it's going to be really interesting to see where each of these companies and brands fit as far as all of those outcome measures. I did see some of the early release of the one company, Corganics, and their stuff is very impressive. Their pain reduction was 64%, their anxiety reduction was 62%, sleep improvement was 62%. So this is a product, and talking to some other doctors that have been using this now for a while, they've found that a lot of the patients have had a lot less pain, much better sleep, and less need for narcotics. So it is, again, part of this multimodal philosophy, of here is this product, but it's a product that you then know is third-party tested, is safe, and you can then add it in, and you kind of know what is going to happen in more of a controlled manner, because you know that the product that you get today is going to be the same product that you get in 6 months or a year from now because of this process. If you're getting products that are coming in batches and those batches aren't tested and they're made in different places, you may not know what's there. So I'm excited about this just because it's a new tool that I have. And talking to my patients, I'm very honest with them. Like, I don't have large trials at this point. Everything that I know is from, speaking to other doctors about their anecdotal reports at this point of their experience with their patients. But if I have patients that are already using CBD products and are wondering if they can continue to use the CBD products, and if they have a recommendation on a brand, then I can say, hey, this is a brand that I trust because of what they do as a company to produce it, and I know that it's safe if you're going to use CBD. Now, what the side effects are for each individual person at this point, we still don't know, and I don't know. So that's where further studies and trials, I think, will be really exciting to see in a more controlled manner and fashion of, what the appropriate dose is. But if you can give a product like this to patients, especially after a surgery, and you can lower the need or use of other medications and improve their pain and improve their sleeping and maybe improve their inflammation. And we know that anxiety is also a big component of surgery and pain and can affect outcomes. This is almost like this wonder drug that can improve all of those things. Now, the other big questions, I think, in the future, and I think we're going to see a lot of studies and research coming out in the next 3, 4, 5 years, because it was just an article I read the other day, I forget which pharmaceutical company, but invested $7 billion with a B, into CBD. So you're going to see a lot of these companies coming out with lots of products. And, the big question will be how many people will these, I don't know if I want to say medicines, but these formulations, how many will they help? What diseases will they improve? And what is the limit on how far you can go with these products? I think we're really entering into an interesting phase of healthcare where for a long time there was a lot of stigma behind it. And I think the stigma is starting to evaporate ever so slightly. But I'm really excited to see where in all of these disease entities, this plays a role. But the isolated sort of approach of my patients as far as total knee replacements, I'm really curious to see how much it improves their outcomes and decreases their need for some of these really bad medicines that have significant side effects, so they have an overall better experience and hopefully better outcomes. So I will get back to you because as I'm learning more and more and I'm reading more and more about CBD and these products, I completely admit that I am a novice. But as I learn, I am going to get back to you and share more and more ideas and information and topics with you to hopefully start to answer some of the questions that I'm sure a lot of you have, because these are the questions that my patients ask me every day. And until recently, I didn't have very many answers for them. And I still don't have a lot of answers, but I have more answers than I had 6 months ago. So in the meantime, stay safe, be healthy. Thanks again for listening. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.